But anyway, she was in this darkened room with this other woman who didn't talk particularly, and she was by this time very discouraged. But in all the records at Sherrill House, not once did they say she was depressed. As a matter of fact, the record said things like cooperative, willing, etc., in other words. And one of the nurses in there who wrote up her condition just before we left said that she needed another 30 days. And I'm sure the physical therapist knew that she was unable to navigate and take care of herself in this house with 10 steps to get in, and then incidentally steps between the kitchen and the bathroom area on the major floor and so on. And the house actually has 5 levels, mind you. But they sent her home there in a wheelchair with me, and I'm 88 years old, and I'm supposed to get her into the house. Luckily, my daughter-in-law was there with her husband, as I said, and he helped me get her into the house. In fact, if he hadn't been there, I couldn't possibly have managed it by myself. So this is partly paperwork, partly malfeasance, and ridiculous. I complained to the doctor in Sherrill House that she wasn't ready to go home, that she should have more time, she needed more physical therapy, and his answer was he had to send her home, etc., which I think was blatantly dishonest. Incidentally, after we got to Booton Wellesley, then they sent her to another nursing home for an extended period of almost 2 months. So I'm not quite sure why she couldn't have stayed at Sherrill House, and if she had, she would have been alive today, I'm quite convinced. Because while she was at Sherrill House, her mood was improving, she was feeling better. We bought her 3 new outfits to wear, and I once said to her, you know, the newspapers are piling up so high on the piano bench, I can't see the piano. She said, don't throw them out, I want to read them. And she was a voluminous reader. She probably read 3 books a week since she was 8 years old. But anyway, she had been on this rising curve of optimistic and so on, but being sent home from Sherrill House with this problem, then going back to the hospital, and then going to Epic, put her into deep depression. From then on, she decided she wanted to die, and she managed. She just wasn't getting her food, which was pretty terrible. They gave her things like hot dogs, and I saw a little meat patty, which looked like a hockey puck, and things of this sort. So, and this being in the long-term section was certainly not a good morale factor, and so on. So, this was our problem. While at Sherrill House, she had another episode, and they sent her back to the hospital, and she was there for a few days, and then without discussing it with me, while she was at Epic after she had left Newton Wellesley, which was after Sherrill House, she was at Epic, and she had an episode there, and she had to go back to the hospital again. And again, she felt better in the hospital, but they shipped her back to Epic House and put her in the same terrible room again. And so things continued that. I complained a great deal at Epic House, and finally they did move her for about the last week and a half or so of her life to a somewhat better room where it was a little better lit, and she was near the window and it was light and so on. But by this time she was very weak and not anxious to live and so on. I gathered only by reading the record of the Epic House, because the communication was very poor. You never saw the doctor. I think I saw him once when we first went there. But they did call in a psychiatrist, and he said she was eloping. And nobody really explained this to me and I only found out about the word eloping, and about the 2 visits that he had in maybe the last 2 weeks before she died, say in the 3rd week of her stay there, that he had even been there and that there'd been any attempt to do anything for her. In other words, she was totally neglected in Epic House. The doctor who works in Epic House works there. He works at the North Hill, which is a very large assisted living place in Needham. He works at another place in Needham, and I don't know if he has other places he works too, but you just never saw him. I think he saw my wife 3 times, maybe in almost 30 days or more, that she was at Epic House. So, so this was the problem. We had 3 doctors. The first one was our regular doctor, and he never bothered to really check on her all the time she was in the hospitals and in the nursing home. Finally, I appealed to him to come and visit her in Epic House. He said he would. A week went by. He didn't. Then finally I brought him. By that point, he could see there wasn't much hope. And at this point, I was trying to move her back to Sherrill, where she'd been happy and had better treatment, and it's a much better facility. But I was discouraged, I think, by the people at Epic and by my own doctor, who finally came to see her when I led him there by driving my car in front of his car from Newton Wellesley Center on Route 9 to Sherrill House, which is to Epic rather, which is just a short distance away. But now, so that's the story of the medical treatment.